Greetings, future and current doctors and nurses of the world and all those lovers of the English language. Welcome to English.Medical. On this video, I've compiled the vital signs, 5 vital signs, including oxygen saturation. There's 4 major vital signs, but I've also included oxygen saturation so you can get a good understanding of how to pronounce that. These terms are very important in an English hospital setting, so I hope you enjoy the video. Okay guys, let's work on a phrase that we use hundreds of times in an English hospital. Say, vital signs. Vital signs. What are the patient's vital signs? What are the patient's vital signs? Excellent job. Blood pressure. Blood pressure. Recycle the blood pressure cuff. Well done. Say heart rate. Heart rate. Another way to say it is pulse. Say pulse. Excellent. What is the patient's pulse? What is the patient's heart rate? Excellent job. Well done. Another important vital sign is respiratory rate. Say respiratory rate. Respiratory rate. Excellent. What is the patient's respiratory rate? What is the patient's respiratory rate? Excellent. Well done. Say oxygen saturation. Oxygen saturation. Excellent. Let's use it in a sentence. The patient's oxygen saturation dropped after she was given 2 milligrams of morphine. The patient's oxygen saturation dropped after she was given 2 milligrams of morphine. Excellent job, guys. Well done. Another vital sign is body temperature. Say temperature. What is the patient's body temperature? What is the patient's body temperature? Excellent. Well done, guys. Excellent job, guys. Well done. Let's practice 2 important sentences that you would hear in an American hospital. Say this. Grab a stat set of vital signs. Grab a stat set of vital signs. Grab a stat set of vital signs. Excellent. Well done. And let's practice sentence number 2. Before giving the medication, update the chart with the latest blood pressure and heart rate. Before giving the medication, update the chart with the latest blood pressure and heart rate. One more time. Before giving the medication, update the chart with the latest blood pressure and heart rate. Excellent job, guys. Well done.